Picture yourself lying on the operating table, entrusting your life to the expertise of surgeons. However, what if I were to inform you that, on occasion, they don't merely excise the problematic elements, they inadvertently leave behind an unsettling surprise? Envision the disconcerting experience of awakening to the presence of an item concealed within your body, overlooked by the very individuals you relied upon for healing. This occurrence seems reminiscent of a nightmare, does it not? Yet for Donald Church, it became an unfortunate reality. How could such a chilling discovery unfold within the presumed safety of a hospital environment? Let's rewind to the beginning of Donald Church's story. Donald was an ordinary resident of Washington, leading a typical life with a job in construction and a family. However, the tranquility of his existence was abruptly shattered in the early 2000s when he received devastating news. He was diagnosed with abdominal cancer. Can you envision the shock of such an unexpected and distressing information? It's akin to having your entire world upended in an instant. Faced with the gravity of his diagnosis, Donald understood the urgency of taking action. Thus, when medical professionals advised him that surgery was necessary to remove the tumor from his abdomen, he recognized it as his best chance at combating the illness and reclaiming his normalcy. Fast forward to May 2000, Donald found himself at the University of Washington Medical Center in Seattle, prepared for the critical procedure. The surgical plan encompassed the removal of the tumor, along with his appendix and a portion of his intestine. The prospect of undergoing such a significant operation undoubtedly evokes apprehension, yet Donald was resolute in his determination to confront the cancer head-on. The surgery proceeded as planned, with doctors skillfully performing their duties and eventually closing the incision. Following a week-long stay in the hospital, Donald eagerly anticipated returning home to commence his recuperation. Consider the immense relief he must have experienced, knowing that the ordeal of surgery was behind him. One might assume that Donald could rely on the medical professionals for guidance and support during his recovery. However, despite his concerns about lingering discomfort, he repeatedly encountered reassurances from the healthcare team that his symptoms were within the world of normalcy. Imagine the frustration and apprehension permeating Donald's psyche as he grappled with the sensation that something was amiss. After suffering from severe pain for several weeks, Donald couldn't take it anymore. He decided he needed to talk to another doctor to get a fresh perspective on what was going on. It's understandable, right? When the doctors he'd been seeing couldn't seem to help him feel better, he looked for help somewhere else. Donald went to see his family doctor, hoping they might have some new ideas about what was causing his pain. During the checkup, the doctor found something strange in Donald's chest that didn't seem right at all. This surprising discovery led to some confusion and concern. Understanding how important it was, Donald's smart family doctor quickly arranged for a CAT scan. This is a way of taking pictures inside the body to see what's going on. Donald was probably feeling a mix of emotions like excitement, worry, and a strong desire to finally understand why he'd been feeling so bad for so long. He really hoped this test would give him the answers he needed. As the time for the results to come in got closer, Donald prepared himself for what they might show. He really wanted to know what was causing all his pain, but when the pictures appeared on the screen, it wasn't what he wanted to see at all. It turned out there was a long metal tool hidden inside his body, about 13 inches long. Just imagine how shocked and scared Donald must have been to see that. Consider the unsettling scenario. Imagine learning that a sizable metal rod has been unwittingly residing within your body. This was the stark reality confronting Donald Church upon witnessing the CAT scan unveiling the presence of this imposing object in his chest. Can you fathom the profound shock he experienced? All the while, he had been grappling with unexplained misery, oblivious to the cause. It's akin to a distressing jest, yet, regrettably, it constituted Donald's actuality. After discovering the presence of the metal rod inside his body, Donald had no choice but to undergo yet another surgical procedure. This time, however, he faced an unexpected twist. He had to seek treatment from a different hospital altogether. Can you even begin to comprehend the incredulity of such a situation? It's like being told, We're sorry for the mistake made previously. Would you consider seeking medical care elsewhere for the subsequent surgery? The gravity of this decision likely weighed heavily on Donald, exacerbating the already substantial stress and trepidation he was experiencing. Consider the immense emotional turmoil that Donald must have grappled with during this tumultuous period. It's conceivable that he experienced a wide spectrum of emotions, ranging from profound anguish and apprehension to deep-seated exasperation. The prospect of undergoing another surgery, compounded by the necessity of seeking treatment from a different medical institution, undoubtedly intensified the gravity of the situation. The uncertainty surrounding the outcome, coupled with the daunting prospect of entrusting his well-being to a new set of medical professionals, undoubtedly added an additional layer of complexity to an already challenging ordeal. Furthermore, consider the logistical and practical challenges that Donald likely faced in navigating the process of seeking treatment from a different hospital. From coordinating appointments and consultations to familiarizing himself with a new healthcare environment, the endeavor undoubtedly presented a myriad of obstacles and uncertainties. Despite the ordeal, Donald exhibited resilience, refusing to succumb to the harrowing ordeal. Instead, he confronted it head-on, resolute in his determination to navigate through it and emerge stronger on the other side. Now, did Donald receive any recompense for the tribulation he endured? Indeed he did. The hospital incurred a financial settlement of $97,000 to redress their error. While money cannot assuage the agony and distress endured, it serves as a form of restitution to alleviate the burden. Moreover, it represents the hospital's acknowledgement of their grievous oversight. Yet, here lies the disconcerting reality. Donald's plight was not an isolated incident. In fact, there were 4 additional occurrences at the same medical facility wherein surgical implements were inadvertently left inside patients. This is not merely an oversight, it constitutes a systemic issue of significant magnitude. Donald's situation sheds light on a grave issue within the healthcare system: the inadvertent retention of surgical instruments inside patients. Such occurrences are deeply concerning, particularly when they happen repeatedly. Hence, it's evident that there is a pressing need for enhanced protocols and accountability mechanisms in hospitals. Surgeons and staff must diligently inspect their equipment multiple times before concluding a procedure. This straightforward precaution could avert a multitude of unnecessary pain and distress. For future patients, here's a crucial piece of advice. Do not hesitate to voice your concerns. If something feels amiss, or if you're unsatisfied with the explanations provided, do not simply dismiss it. Engage with your physician, pose questions, and if necessary, seek a second opinion. Though it may seem daunting, prioritizing your health is paramount. Consider the impact. If Donald hadn't pursued that additional consultation, his suffering may have endured indefinitely. Moreover, let's consider the broader implications of Donald's ordeal. It transcends his individual experience. It underscores a systemic issue affecting all hospital visitors. Consequently, substantive reforms are imperative. Hospitals must prioritize patient safety above all else. This entails investing in comprehensive staff training, enforcing stringent protocols, and fostering a culture that acknowledges and learns from mistakes. While challenging, these changes are indispensable to prevent tragedies akin to Donald's from recurring. In essence, the overarching lesson is one of patient empowerment. Familiarize yourself with your rights, ask pertinent questions, and advocate for your well-being at every juncture. Ultimately, nobody possesses a greater stake in your health than yourself. So don't be afraid to speak up and take control of your healthcare experience. What are your thoughts on this? Let us know in the comments below, and don't forget to subscribe to our channel.